My name is Megan Magnus. I'm a dietitian at Evans Army Community Hospital, and this is Bariatric Nutrition Class 2. You have probably just watched the recording of Class 1. We are going to be going through some great information in this class today. So, first of all, I would like to start out with your pre-surgery diet, and then today we will progress through your diet stages after surgery so that you're prepared with what you should and shouldn't eat and how long you should eat those foods after surgery. Prior to surgery, Evans Army Community Hospital recommends that you do the liver shrinking diet. This is explained in our bariatric orientation for the importance of following this diet prior to surgery. This starts 2 weeks prior to your surgery date. For breakfast and lunch, you can do 2 servings of protein foods. Each protein food is 1 ounce of meat. So this can be lean meat, poultry or fish, and each serving is 1 ounce. For example, at breakfast, you could do 2 ounces of skinless chicken breast. Non-dairy or dairy alternatives, or non-fat dairy or dairy alternatives can also be used as a protein serving. These serving sizes would be 1 cup of skim milk, unsweetened soy milk, 6 ounces of sugar-free, fat-free yogurt, 1/4 of a cup of fat-free cottage or ricotta cheese, or 1 ounce of fat-free cheese. All of these are examples of your protein foods. If preferred, you can do a protein shake that is low in sugar and high in protein and low in fat for both breakfast and lunch. It is not recommended to do more than 2 shakes per day if using them as the meal replacement for the protein foods. For your dinner meal, you need to have 3 servings of protein foods. That would be a total of 3 ounces. Again, this can be lean meat, poultry, or fish, or you can do a dairy alternative or a non-fat dairy. You need to have at least 1 full cup of non-starchy vegetables. An example of this would be broccoli, kale, cauliflower, carrots, zucchini, asparagus, Brussels sprouts. Those are all non-starchy vegetables, meaning that they have little to no carbohydrate in them. They're very high in fiber, and these can either be cooked or raw. 1 portion of either starchy foods or fruit. For this menu, you need to refer to your booklet and the sample menus that are in that booklet for the portion sizes of the foods. You can have 1 to 2 snacks per day when you're on the liver shrinking diet. Snacks would include a fruit, a vegetable, or a protein serving, which would be 1 ounce. These are your free foods. You may have sugar-free Jell-O, broth as long as it doesn't have any noodles in it, dill pickles, sugar-free popsicles, sugar-free beverages, and you can have salad greens. You can have sugar-free gum, but this is not recommended after surgery. This is your sample meal plan for the liver shrinking diet. This is also provided in your booklet. I give you a separate sheet usually that has your liver shrinking menu on it, and in the future we're going to include that in your bariatric booklet. Breakfast, you could do a protein drink. An example would be Premier Protein or Fairlife Core Power or Unjury. Those are all products that are very low in sugar, low in fat, and high in protein and appropriate for bariatric patients. Or you could have 1 cup of skim milk with 1 scrambled egg white. Protein drink or 1/2 cup of low-fat cottage cheese could be your lunch. You can have an afternoon snack that is 1/2 of a banana, Portion size is very important here. And dinner could be 3 ounces of skinless chicken breast that's baked, not fried, 1 cup of cooked broccoli, and half of a cup of cooked yams or sweet potatoes. Snack in the evening could be 1 cup of berries. Remember, maximum of no more than 2 snacks per day. We are roughly trying to keep carbohydrate to no more than 80 grams per day. You are still trying to reach your 60 to 80 grams of protein per day, and you must drink 48 to 64 ounces of sugar-free, caffeine-free fluid every day when you are on your liver shrinking diet. Stage 1, bariatric clear liquid diet. Now this is only while you are in the hospital after surgery. This usually lasts about 2 to 3 days. I do recommend that everyone sit up and get out of bed and move as soon as surgery allows. Only clear liquids can be consumed on the clear liquid diet. Follow your booklet for examples, and I will provide you with some examples today. Consume 1 ounce of fluid every 15 minutes for the first 4 hours after you are allowed to have the clear liquid diet. When you're in the hospital, you will be ordered a clear liquid diet. The nurse will then provide you a clear liquid diet tray, and they will give you a sheet that has 15-minute increments. You are supposed to sip on 1 ounce of fluid every 15 minutes for the first 4 hours to make sure that you're having tolerance of fluid after surgery. If you have nausea, please let nursing know. If you're having vomiting or any other digestive issues, please let nursing know. The goal for discharge is to consume up to 40 ounces before you discharge from the hospital. So a goal of about 40 ounces within a 24-hour period after you're allowed to start your clear liquid diet. Remember, you are not allowed to use a straw or carbonated beverages after surgery. Do not exceed 8 ounces in 1 hour. Remember, 8 ounces is the max volume that your stomach can contain after surgery. So we do not want to exceed that fluid volume. Clear liquid diet examples. This can be broth, beef, chicken, vegetable, or bone broth, any type of sugar-free Jell-O or popsicles, and you can do any type of sugar-free beverages such as Crystal Light, Propel, sugar-free lemonade, zero-carb Isopure, decaf tea, and herbal teas are fine as long as you're not using regular sugar. You can even use like stevia and Splenda packets in those. Decaf coffee is allowed, but not until after discharge from the hospital. You can have a small amount of that at home as long as you're not adding sugar to it. ProSource is what we provide in the hospital. This is a high protein liquid shot that you're allowed on your meal tray. You can put it into a beverage, or you can take that protein supplement straight. Currently we have a berry punch flavor, and you can get ProSource on your own. It is a very concentrated protein product that's usually sweetened. Stage 2, full liquid diet. This starts after discharge from the hospital, so your first full day at home. It lasts for 2 full weeks. It is the consistency of milk. Now remember, with these diet stages, we are adding on, we are not taking away. So you can still have clear liquid, and now you can have full liquid texture. Everything that you consume should have less than or equal to 5 grams of sugar per serving, 20 grams of protein at least, especially if you're using it as a meal replacement, and less than 3 grams of fat per serving. High protein drinks and powders are very often implemented during this stage. You have a goal fluid intake of 64 ounces per day, but I want everyone meeting at least that minimum of 48 ounces per day, especially in your 2 weeks of your full liquid diet. Protein is priority. Remember, we need to meet our protein goal and our fluid goal during these stages. Full liquid examples. Now remember, you're only going to be able to consume a very small amount of liquid after surgery. It is recommended that everybody get little medicine cups to help them with portion control. They usually provide those to you when you're in your clear liquid stage in the hospital. So little tiny medicine cups are very helpful when you're trying to portion out your liquid part of your diet. You can consume 2 to 4 ounces of a Premier protein shake or a Fairlife Core Power protein shake. Up here I have a picture of the chicken broth from Bariatric Advantage. This is a high protein chicken broth, so there are some savory products out there too. Now remember, this is when you need to start sipping very slowly. So sip, sip, sip for your full liquid diet. 2 to 4 ounces of strained low-fat cream of chicken soup made with fat-free or 1% milk. Another example of a full liquid would be 2 to 4 ounces of non-fat, smooth, plain sugar-free Greek yogurt. An example would be Oikos's 000. That's a really great product if you want a lot of variety of flavors, sugar-free, very high in protein, and low in fat. 2 to 4 ounces of sugar-free pudding that is thinned with fat-free or 1% milk. If you are lactose intolerant, I would suggest getting any type of lactose-free. One of the brand names for a lactose-free milk is Lactaid, or you can use unsweetened soy milk if you're lactose intolerant. If you have a dairy allergy, I would recommend the unsweetened soy milk. It's going to be the best product to use because it is higher in calcium and protein. Stage 3, bariatric pureed or blended diet. Your blended puree foods are added on to your clear and your full liquids. This is the consistency of baby food. I recommend that we start by measuring out no more than 1/4 of a cup at one time, maybe a little bit more for your meals. 2 ounces would be kind of a measurement to start out with. Always eat your protein food first. So if you have protein and a carbohydrate food, always choose that protein food first. We're not trying to eat carbohydrates first right now. Beverages should be avoided 30 minutes before and after meals. This is when we start this cutoff point for sipping on our fluid and focusing on our food. Consume 3 small meals and 1 to 2 snacks per day. So an eating routine is really recommended so that you're getting your protein and your fluid in. Remember that that is priority. These meals are very small. They are not your normal meals. So remember, a meal could even be just 2 to 4 ounces of volume. Blended puree examples, meats and protein. This is the texture of baby food meats. Scrambled egg substitute or egg whites could be used as a protein, and that is considered pureed. Fat-free or low-fat cottage cheese or ricotta cheese. You can incorporate those at this point. Remember, you can still do your protein shakes. That is going to be a big source of your protein for the first few weeks after surgery. Vegetables. Remember to avoid gas-forming vegetables such as cabbage, Brussels sprouts, broccoli, and then also tough and stringy vegetables. Things like corn, celery, and asparagus are not usually pureed or blended very well. The best choices are going to be cooked and blended carrots, green beans, and squash. Those usually blend up very well. Limit all starchy vegetables. Remember, the starch or carbohydrate is not priority here, including things such as peas, beans, lentils, sweet potatoes, and white potatoes. These should be last and least. I need you to meet your protein need first. You can add a small amount of unsweetened fruit. That would be such as unsweetened applesauce or bananas. Avoid anything that has lots of skins or seeds. So a whole apple would not be recommended, but usually the unsweetened applesauce is fine. Stage 3 considerations. For the first couple of days, do not add any fruits or vegetables. Focus on adding the new proteins. Then slowly add your fruits and vegetables if proteins are tolerated. Remember, this is a gradual progression after surgery to make sure we can tolerate these foods. Consistency of smooth paste or a thick liquid. That is what puree is. There should be no distinct pieces of food in the puree product. Remember that your digestive system still may be very sensitive after surgery, so we do want to limit all spicy foods, and dairy is usually a common irritant. And I mean lactose when I'm talking about dairy. So most patients are lactose intolerant after surgery, and most of the protein products that you're going to be consuming are lactose free, even though they contain milk. If you need to make your own puree foods at home with your own blender, I would suggest using broth, fat-free milk, or hot water for blending. That way you get the texture you desire. Stage 4, soft diets. We're getting close to being back to normal food. Remember, we're adding on, so we have clear, full, pureed foods, and now we're moving on to a softer food texture. So this is going to be more like solid foods. The biggest difference is going to be that there's not going to be usually raw fruits or vegetables, and meats are going to be very soft cooked, not tough meats like steak. This usually begins about 4 weeks after surgery or when you're directed by your physician. This lasts usually for 1 to 2 weeks. You do not have to stay on this regimen for a full 2 weeks unless you desire to. Now for the other stages, full liquid and puree, you have to be on those for 2 weeks each. Soft food. No raw fruits and vegetables and no tough meats. You are still going to be consuming 3 very small meals and maybe 2 very small snacks per day. Reminder, no fluids 30 minutes before or after or during those meals. Soft food examples. This can be products such as canned chicken, tuna, cooked ground turkey, ground beef as long as it's lean ground beef, so 90% or greater, eggs, and fish. Milk. You can do skim or fat-free milk as tolerated, low-fat or non-fat cottage cheese, low-fat or non-fat cheeses. So I usually give examples such as the light Baby Bell or string cheese. Those are better low-fat cheeses to choose. Starches. You can do a very small amount of starch if you're tolerating your protein and your veggies. Remember, those come first. Hot cereal or plain oatmeal. I would suggest a very small amount of beans, peas, or skinless potato. And small amount, I mean like no more than a tablespoon of beans. Usually with oatmeal, that needs to be like 1/4 of a cup, so about 2 ounces. Very small amounts. Fruit. You can do, I skipped vegetables. Soft canned vegetables are fine. Well-cooked frozen vegetables. Remember, there should be no skin, seeds, or strings in these vegetables. So we can have cooked vegetables, they just should not be raw at this point. Fruit. You can do soft canned or fresh vegetables. Usually better options are bananas, berries, and peaches. And try to, if you're selecting any kind of canned fruit, do not get the brands that have added sugar. If they come in fruit juice, make sure you drain the fruit juice off of the fruit. Do not choose any type of syrup in canned fruit. Stage 4 considerations. Do not add rice, bread, or pasta. until much later, and especially until you're consuming at least 60 grams of protein and all of your fruits and vegetables. This needs to come later on. These foods do tend to swell a little bit for more people. They are high in carbohydrate, and so that's not what we're trying to focus on. We do want to make sure that you're getting your protein intake first. To moisten your meat, I would suggest using low sodium bouillon or broth, or even light and fat-free mayonnaise. You can also make sure that foods are cooked for long enough too. When you are using things like a crock pot or a pressure cooker, they tend to make that meat a little bit more moist. Foods should be able to mash easily. If they're not, cook it a little bit longer. Usually that helps. Your regular diet. So after you've been on that stage 4 diet, soft diet, for about 1 to 2 weeks, you can start adding in some regular textured foods. That would be like raw fruits, raw vegetables, and maybe a little bit tougher of meats. You still need to be chewing very well and eating slowly. Remember, it should take you 30 to 60 minutes to finish a meal. And that is a meal that is less than 8 ounces. This will begin approximately 6 weeks after surgery, when solid foods are better tolerated. Overall, this diet is low in fat, low in sugar, and high in protein. Add foods one at a time to check for tolerance. This is important, especially if you're having some discomfort when you're adding new foods in. You might want to wait a few days and then try that food again. Remember, portion size matters. So portions are just as important as food content, what we're eating. Aim for a balanced diet, including lean proteins, fruits, and veggies. Those should be your priority. Now let's review. We just went through your 6 weeks after surgery, your diet progression, and this is so important to follow this diet progression. Clear liquid diet, this is only while you're in the hospital. Full liquid diet, once discharged from the hospital until 2 weeks after surgery. Puree or blended diet, from 2 weeks until 4 weeks after surgery. Soft diet, from 4 weeks until approximately 6 weeks after surgery. And then regular diet, this starts usually about 6 weeks after surgery and then continues for the rest of your life. Don't start adding in old habits, old snack foods and cheat foods. Remember that you still can regain weight after surgery, and so I discourage adding back in higher sugar, higher fatty foods. If you're not tolerating a diet, then do not advance to the next diet until you're tolerating. So follow up with your dietitian or your surgeon if you are having any type of intolerance. That means vomiting, nausea, stomach pain, diarrhea, any type of discomfort, gas, bloating that's more significant. Please discuss that with myself and General Surgery or one of the dietitians at Nutrition Care Division. If you are vomiting and not keeping fluids down, I would instruct you though to go to the ER. Now, if you're having some intolerance issues, what we usually recommend is regressing in the diet stages. You can go back to full liquid or pureed for a few days until symptoms resolve. Okay, let's continue to review. So your goal of fluid is 48 to 64 ounces per day of non-caffeinated sugar-free liquid. You have a daily protein goal of 60 to 80 grams after surgery. You need to start taking your vitamins day 1 at home. So the first day that you're at home after discharge, you need to start taking that multivitamin supplement. So that's when you start your full liquid diet. Continue your vitamin and mineral supplement regimen for life. Remember, these supplements after surgery need to be chewable or liquid form for 6 weeks after surgery. Remember, no gummies. those are not adequate. They do not have iron in them, and they're also poorly absorbed by our body. For calorie need, after surgery, when you are in active weight reduction and less than 1 year after surgery, our calorie average is going to be somewhere between 600 to 800 per day, at least less than 1,000 calories per day until weight loss goal is achieved. Now, once your weight loss goal is achieved, calories do go up slightly, and that depends on the person and your activity level where your calorie need will be. At that point, I do suggest getting a metabolic test at the Army Wellness Center to figure out where your calorie need should be once you're at your maintenance goal. Common problems after surgery: unsuccessful weight loss due to consuming too many calories or too much energy. Dumping syndrome. This usually occurs when we are consuming very high fat and high sugary foods that we shouldn't be. This usually starts with nausea, abdominal pain, followed by diarrhea within 15 minutes after eating. What is happening with dumping syndrome is there's rapid emptying of the gastric contents into the jejunum or small intestine. A lot of times people also experience difficulty adjusting to drastic changes in their eating and lifestyle. And that's why Class 1 is so important. Starting to make those lifestyle changes now instead of waiting until right before surgery or after surgery. Tips to avoid complications. Remember, chew your food very thoroughly. Count 20 to 30 times per bite. Do not overeat. You will feel miserable. Do not eat too fast. Remember, it should take 30 minutes to finish a meal. Do not lie down after eating. That definitely can cause heartburn now, and it will make things even worse after surgery. Avoid foods that cause distress, so spicy foods, fatty foods, sugary things, and sometimes dairy products that have high lactose content. Eat puree or liquid foods until your symptoms resolve if you do have gastrointestinal symptoms. Dizziness, headache might be a sign of dehydration, so consider that you're not drinking enough fluid. Make sure that you're consuming your 48 to 64 ounces of non-caffeinated, sugar-free, non-carbonated fluid. Meet fluid and fiber and activity goals to avoid constipation. Now, fluid is very important and fiber is very important for preventing that constipation after surgery. Remember, we are going to be on a very high protein diet, and so this is a common issue after you have surgery. It is very important to make sure you're getting your vegetables in once you're able to. Foods that can cause intolerances. These are just a list of some common foods that people have irritation with. Of course, high fat or very high fiber all at one time. Fried foods are going to be very high in fat. Tough meats or dry or overcooked. Spicy foods, things like chili, might not be the best to incorporate right after surgery. Skins of vegetables. Granola and nuts. Those are very rough, tough foods, so that might be difficult to tolerate. Rice, bread, and pasta, which can typically swell up a little bit more in our stomach. Popcorn and coconut. Dried fruit with the skin. Carbonated beverages and alcoholic beverages should be avoided 1 year after surgery, at least 1 year after surgery. And then sticky or gummy foods. Those tend to cause more irritation. And we're at our summary. So bariatric surgery will require many lifestyle changes, but you can do it. With proper planning and practice prior to surgery, this increases your likelihood of success. And we want you to be successful. That is what we are here for at Evans. We are your Bariatric Center of Excellence, and we're here to provide you encouragement, information, and anything that we can to make you successful. Failure to comply with recommendations is the most common reason for being unsuccessful, so make sure that you are following our recommendations. Utilize your support systems on your journey. So we are your resource here at Evans, and then also think about those support systems at home as well. What's next? So complete your bariatric lab panel. Again, I'm going to remind you again. I reminded you in class 1, but remember, you have to do your labs prior to surgery. If we have any type of nutrient deficiencies, we need to correct those before you are allowed to have your surgery. Remember that some labs can take up to 7 to 10 business days before they're resulting, and so that's why we want to make sure you're getting them done on time. Please complete and bring your assessment to your 3rd appointment with the dietitian. Now this part, in class 2, I will be handing you a nutrition assessment. It is a summary of everything that we have discussed in class 1, class 2, and all of your answers are in your bariatric nutrition guidebook. So I need you to complete the questions and answers, the answers on that form prior to your 3rd appointment with the dietitian. The 3rd appointment with the dietitian is scheduled usually as a shared group appointment, or it can be an individual appointment if needed. We will discuss scheduling your 3rd appointment with the dietitian during your class 2. So don't worry about that when you schedule class 1 and class 2. Good luck, and that is the end of my presentation today. Thank you for joining me.